Hey, I'd like to welcome you to another episode of Mission Matters. My name is Adam Torres. You can follow me on Instagram at Ask Adam Torres. And if you'd like to apply to be a guest on the show, just head on over to missionmatters.com and click on Be Our Guest to apply. All right, so today I have Dr. Tracy Blount on the line, and she is owner and dentist at Dental Design PC. Dr. Blount, welcome to the show.
Hi, thank you.
All
It's good to be
right.
here.
Oh my gosh, I'm so excited to have you on the line today, and we're going to talk about one of my topics that I got some stories to share with you today, but
Okay.
essentially the mouth is part of the body, and like why
Yes.
dental hygiene, all these things are important. So we'll get into that, but before we
Okay.
do, I'd like to start with our signature question. So Dr. Blunt, we at Mission Matters, so we amplify stories for entrepreneurs, executives, and experts. So that's our mission here. Dr. Blunt, what mission matters to you?
Complete total health care and total health. And total health includes the mouth. Isn't that awesome? We have teeth. So we have to maintain them like we do with everything else in our body. Sometimes I'll talk with my patients, especially the young ladies, I said, wow, you're just so dialed up. Your makeup's perfect, your hair, your nails, you look great. And then when you open your mouth, we want to make sure our mouth is healthy. Gentlemen, too, of course. But also, we can't forget, and it's for the whole medical community also. I think healthcare should include medicine and dentistry together.
Mhm,
We have to include dental care with part of healthcare and the healthcare plans and
mhm.
not totally separate. That's a different story too, but it all goes together. It really does.
That's wonderful. And so let's just get started, maybe from the beginning. Like, how did you get on this path to dentistry and to being a dentist?
Well, I was always a math and science person, just
Mhm,
through especially high school, and then I wanted to be a doctor. I just didn't know what kind. At first, I was
mhm,
going to be a doctor of pharmacy, but I said, I don't think I want that. I want more of a practitioner side.
mhm,
And I pictured myself working in a store the rest of my life. I said, I can't do that. And of course, there's more to pharmacy than that. But
mhm.
I talked to physicians and dentists, and through just different dentists. I said, I can do this. I like it. So I, you know, took that direction.
So in building your practice, I mean, you've been a dentist for some time now, but there's some
Yes.
people watching this that are maybe kind of just get a little bit earlier in their career, and they might be thinking about dentistry as a profession and as a
Mhm.
field. Like, what
Yes.
kind of what kind of advice would you give to those out there that have kind of considered it, but they're like they haven't quite, they don't know exactly what to expect? What would you tell them?
I would tell them, especially with dentistry, you have to want to care for the person. And,
Mm,
and dentists do. We just
yeah.
have a heart to help and serve patients. And you have to just keep that in mind. And when you do that, when you have the ultimate goal, the patient's mouth, then everything comes together. When you stay patient focused, everything else comes.
Mm. And now, in terms of being a business owner and an entrepreneur within the dentistry field, I mean, what are your thoughts on that? Because that's a slightly different path, yeah.
It is. It takes a lot, and I used a consultant very early in my career. Actually, about 2 or 3 years
Mm,
after I opened my practice, which was great. They were awesome because sometimes the business portion
mhm.
of handling or managing a private practice isn't taught like all the other
Yeah.
areas in dentistry. And so it really helped to use a consultant for that period of time. So that way you can structure your practice and your life to help make it easier for the things that you need to do. So that was really important
Man, that's
because yeah, it was because of the dentistry, but it's managing the staff and patients as far as the business portion of it, and just all the compliances, everything. So it's just
Yeah, I can
different.
see that
Yeah.
because I mean different career paths, right? Obviously, a
Mhm.
dentist doesn't have to have their own practice, so they can be the entrepreneurial side, or some want to come to work and they want kind of some of that done. And there's other fields within medicine that are similar in
Mhm.
terms of to be an entrepreneur and not to be an entrepreneur. So
Mhm.
definitely two different paths there. And so I like your
Correct.
perspective though, in terms of using a consultant potentially in the beginning, if
Mhm.
that's like, because you're not, because when you go to school, and now correct me if I'm wrong here, but like they're not teaching you necessarily to be an entrepreneur, they're teaching you to be a dentist, right?
Correct, correct. They do cover some areas of owning a practice, but not as much with practice management.
So dental design PC. So
Mhm.
let's dive into your practice. So tell us a little
Okay.
bit more about the practice.
Wow, let's see. We actually we relocated and we were so excited. We were at one location for a while and we just relocated prior to COVID, like 4 months before COVID.
Mhm.
It's like, but we love it. We treat children, young adults, older adults. We cleanings, crowns, bridges, denture,
Mhm.
implant restorations. Just it's awesome.
So let's get into, I kind of want to start on the beginning on this one, kind of the
Okay.
preventative maintenance side of dentistry. So a lot of people watching this, and maybe some of them haven't been in, a certain type of dental routine or thing, or maybe especially during the COVID. And I'm going to put myself under a bus here, so to speak.
Okay.
And when everything hit and everything happened, like I missed a couple of appointments. Like I was
Exactly.
just thinking like, what should I do here? But now I'm back on track. Thank you. So
Yay.
thank you, Dr. Blunt. I'm back on track, and my dentist is on my case about that one, so no worries there. But like, tell me a little bit more about the preventative side of maintenance and like why that's so important.
It's so important because there's a lot of things we can do individually to help keep us at a better state later in life. And sometimes I'll see older patients and they just wish they knew more and they,
Yeah.
they just didn't know. And then I see younger patients that may not take the time to floss. I'm like, if you can just do this, it's going to help you so much in years to come. It's like if you only knew, because periodontal disease is really destructive. It's a silent
Mhm.
disease and you don't know
Mhm.
until you have some mobility. You wonder, why are my teeth starting to spread? Why are they getting
Mm.
loose? You don't realize that when you're young, 16, 17, 8, 25. But then when you hit 55, 60, and
Mm.
you get a toothache and things start to swell, you wonder why. And I think if you could have just done something differently, and that is actually flossing, that's a huge difference. That can make just a dramatic change in your dental health.
Wow. So something as simple as flossing can
Something
make a
as
big
simple
difference.
as
Like, and
flossing.
so like I mean, like your thought process, like
Mhm.
people that aren't flossing, they know they should be. They're like, you're like, please just floss. It will help. And by the way, so my
Mhm.
dentist and I, or I should say the hygienist, the one that cleans my teeth. So we'll play a game. Like I don't know what that thing's called that they put in between your teeth, where they measure the four and the fives and the
Yes,
threes.
yes.
And
Oh, you know.
I'm over here
Yes.
like we take bets, and she she laughs at me because when I come in, I'm like, all right, watch 0 5s this time. Watch maximum 3 4s, and like it's like we're playing cards. She's
Exactly. One,
like,
two, three. Yes.
and
Four,
when I
five,
get
sixes, there is a concern.
and when I
You
get a
think-
4, I'm like, I demand a recount. I think
That's
you
right.
could have been a 3. You're not being liberal today with your numbers.
And I tell people not flossing is like dipping your hand in a jar of honey. Then wash your hands with your fingers closed. So when you open your fingers, there's still honey between your fingers, right?
Oh
So when you
wow.
brush, you clean the outside and the inside. But what about the food between your teeth? The toothbrush can't reach it, so it just
Mhm.
sits there.
Mhm.
So over time, that food turns into plaque, and that plaque is just bacteria.
Mm.
And then your body starts to say, disease, infection, I don't want this. And that plaque gets hard, it turns into calculus.
Mhm.
Then you hear it on TV as tartar. And so that's what your body's fighting, that tartar that's on your teeth. And
Mm.
then over time, your gums can swell and bleed, and your body starts to resorb the bone that holds your teeth in. Then your teeth spread, get loose, and fall out. So then you back up and say, well, what if I remove that food from between my teeth with floss? Would that have made a difference 50 years later or 60?
Wow. So yeah, so all the young people that are watching this right now that are thinking like what did you say to be able to enjoy a steak at 85? Like, come on.
Yes.
Like
You know, as I tell my patients, they come regularly because, you know, even with flossing, we can't get everything. I mean, if floss
Mhm.
goes down a millimeter, millimeter
Sure.
and a half or so, so you still need a professional to get down further for you, but you're just
Mhm.
that much more advanced if you do something yourself.
Mm.
It makes a difference because we do want to go to the dentist every 6 months. Every
Mhm.
4 months is great. You know, it takes
Yeah.
3 to 4 months for that bacteria to build up to do damage. So if you have someone going in there every 4 months for you,
Mhm.
but then you say, well, I can't, well, it'll make a big difference too as far as flossing your teeth. Actually
Mm.
scrape the food off your teeth. Don't just try to get food out from between your teeth. It's a big
Mhm.
difference when you're scraping your tooth clean versus just trying to get something out. And so that's why. And water picks work well too. You know,
Mhm.
you can use a water pick that helps clean
Tell
between
me a
your
little bit
teeth.
more about this water pick because
Think of
I have some people that have used them. I have
mhm,
not.
mhm.
And I like tell me a little bit more about this thing. Do I need one of
Well,
these? I'll
you
get it.
can if you're not flossing well.
No, I'm
But
flossing, but I still,
okay,
I'll
good.
take a gadget if it's going to save me some pain and keep my teeth nice.
Well, water, think about like a hurricane or something just goes across the
Mhm.
um like a hurricane. It just drags everything with it, or more that's more so than a tornado. But a
Mhm.
hurricane would drag something across with it. So what a water pick does, the water flows between your teeth and it just pulls the plaque and debris from
Mm.
between your teeth, and that's what helps it clean. Just like flushes the food from between your teeth.
So the schedule, I think you mentioned a moment ago, but I want to spend a little bit more time on that. So is
Okay.
there a difference? So like let's say you're younger versus
hmm
or like you're a kid to teenage to like to more senior. Like what is the schedule that people, and of course this is going to be different for every person based on, their particular needs, but like what
hmm
are some good rules of thumb in terms of like how frequently they should be going to the dentist?
It's great to go twice a year. If you
Mm.
can go every 6 months, that's great because then you can have your teeth monitored and clean.
Mhm.
You have x-rays about once a year, sometimes every 2 years.
Yeah.
The number of x-rays just depend on what cycle you're on, but
Mhm.
that lets us detect decay between the teeth. Sometimes when people do have periodontal disease or borderline periodontal disease, we'll have you
Mhm.
come in every 3 or 4 months, which is
Mm.
great. Yeah.
I'm on them once every 4 months. Like I'm
Oh,
a
that's
once.
good.
Oh,
Oh,
for
that's
sure.
great. That is great.
I'm they get me like I'm just scared. I'm like, all right, I'm gonna get in there right now because if I
Mhm.
don't, then something bad might happen to me later down the line. I just wanna
Keep
keep
them
my
clean,
teeth.
huh? Yeah. And some insurances are starting to cover cleanings 3 times a year, which is great,
Mm.
you know, but right now most of them still cover two.
So how does does the insurance side of thing work? Because you mentioned earlier, like when we kind of warmed up in the beginning of the show, you mentioned that, it should be included. It might not be. Like, give me a little bit more of a feel for just kind of the insurance side of how you think it should work.
But really, insurance plans are purchased usually by your employer
Hmm.
and not necessarily individually, but individually is some people can
Yeah.
purchase their own outside, but Um, it depends on what their purchase employers or
Hmm.
employer purchases or negotiates with the company. And so it would be nice if with medical insurance, a
Yeah.
dental policy is attached to it and not a totally separate policy.
Mm.
And it's a long way to go from that. But sometimes people have medical insurance, but they won't
Hmm.
have dental. But I think
Hmm.
if you have medical, you should have dental. But I guess you could say that for ophthalmology also. But we're talking about dentistry today, so
Well, I mean, it does make sense though. Like
yeah,
your mouth, like your eyes, your like, it's all part of the health. So I get it completely. I don't know how that was originally like split up, but I'm guessing it
right,
wasn't by. It was definitely not by the patients out there.
right.
Let's put it that way.
Right. But one of the things too is that if you don't have the teeth that you need to eat the food that
Mm.
maintains your health, it's a
Hmm.
problem because people that don't have the teeth that they need to eat
Hmm.
properly, they end up with softer foods. They end up with more
Mm.
carbohydrates. Well, if you have more carbohydrates, then of course that increases your blood sugar. You don't have the healthy, crunchy foods like raw foods or nuts or,
Mhm.
carrots, apples, things like that. You want to be able to eat healthy food. So
Yeah.
I notice a lot of elderly too. Of course, they want to cook down their food, which of course you have less nutrients when that
Mhm.
happens. So it's just a whole process in digesting your food, or you'll swallow the food whole more so than chewing it
Uh,
to help break down the food to help your digestion. So things like that. So
mm.
it's
So
different.
let's talk a little bit more about so if somebody's on they haven't been to the dentist, I should say, in quite some time, and maybe I feel like most people, like once they fell out of that habit, so to speak, and I could be just speaking for myself, but I think
Hmm.
there's a point in time into, like when I was in college, I think I did
Okay.
at one point in college neglect my teeth for a solid like 2 years possibly.
Hmm. Hmm.
And I paid for it after with a lot of a lot of cleaning, a lot of like digging they had to do to undo some of the things that I'd done by not coming in, right?
Hmm.
So if somebody hasn't been, like, let's just say, to the dentist in a while, obviously they should be going, but if they haven't been, like, what are kind of some of the words that you'd give to them, like in terms of like getting over it and getting back in?
Start where you are,
Mm,
you know, start as far as increase your brushing
yeah.
morning and night, because a lot of times people aren't doing that morning and night. And of
Hmm.
course, start flossing. Now, of course, you have to make your dental appointment. You know you're
Hmm.
there, but at this point, when I tell people, I said everything didn't happen all at one time. So don't expect to come in and have to get everything done all at
Yeah.
one time. You're better off going step by step, little by
Hmm.
little, and before you know it, your treatment's complete. Most treatment plans take about 2 years.
Mm,
So even if you get a full treatment plan, just take it in bite-sized pieces, little by little, and before you know it, you're done. So don't give up. You have to start somewhere. So start where you are. But you're with you every day. You're with the dentist, 2 or 3 times a year. So it's almost like an oil change versus
hmm.
a new engine.
Hmm.
So if you just help maintain yourself by flossing and eating the proper foods and not so many sugary foods or pop and soda, pop
Hmm.
and soda, but juicy juice with the 10% fruit juice.
Hmm.
And there's just like monster drinks. There's just so many things. It's just sugar everywhere, so you have to keep the sugar out of the mouth. That helps a lot too. And if you do have something sweet, once in a while, get some water, swish it around, get that sugar out of your mouth, kind of neutralize your mouth until you can go home and brush and floss your teeth. So to go back to your question, start where you are, just one step at a time, and we'll help get you on the right track.
So another thing that I've just noticed, I mean, since I was a kid, and maybe I'm off here, but like
Mhm.
technology in dentistry has
Mhm.
it just keeps advancing, just keeps going more and more. Like I can see different like equipment, different things, different. I can't claim different techniques, but because I haven't had any like big major dental problems in my particular case. But
Mhm.
tell me a little bit more about like the evolution of dentistry and like what you've noticed in your chair.
What I noticed in my chair is that through a lot of the programs, through just the government, just
Hmm.
through just in general, just
Yeah.
life, there are more people that do pay attention to their teeth.
Mm.
Dentistry has improved, it has increased, the knowledge is there. People want the white smile, they want their teeth clean, they care. People care about their health, they care about their mouth. And that makes a big difference. It
Hmm.
really, really does, even though there's things that we should do, as we know, we just talked about.
Hmm.
Um, but people do really care about their mouth and they want a nice smile.
Hmm.
Now, dentistry has made this a lot easier by the different anesthetic that we use. It's a
Hmm.
lot easier. I have patients at first may come in very fearful, but then like my patient today, it's like, okay, you can get up now. She's ready to go to sleep. She's like, wow, I'm ready to go to sleep. you know, and so there's wonderful changes with dentistry as far as pain control, as far as treatment skills, like even with root canals, that used to be just such a fear for people. We
Hmm.
have rotary endodontics. We don't have to use a hand file. A lot of procedures don't take as long now with
Hmm.
crowns and now with implants also for restoring teeth. So you don't necessarily have to have a denture or a partial denture. You have different options to replace teeth that are missing.
Yeah, that's what I thought. So I'm not
Mhm.
wrong on this.
No.
Like the field of dentistry, like over the last since I was a kid, the last 20 years, like
Mhm.
it's changed quite a bit, because now
Absolutely.
I mean, I can remember like hearing people say, like when I was growing up, like they had to go get a crown, or they had to like get certain things done, and it was like an ordeal. I still remember this
Mhm.
stuff from when I was a kid, or like thinking of all these things, because I'm like, oh my gosh, that's my, like, I never want to get one of those. And now when I hear people like go and get things done, it's like it's quick. Like they're like, oh yeah, I had to go get a crown, and I'm like, they're talking about it almost as if I had to go get a filling or something like
Right,
that, like back in the
exactly.
day. And I'm thinking to myself, like, wait a minute, like, are you okay? Like, I don't, this could just be my uneducated view of when I was a kid, but I remember
Mhm.
this stuff being like different. I swear I do. And
Right.
now when people talk about it, when they get things done, it's just like, to me, it's just like it's progressed. And now there's a big difference. And like when you talk about like the education and the knowledge being out there and the procedure, and also the I would argue, and I don't know if this would be the term we use in dentistry, but I know we use it in other fields, and that's the client journey. So
Mhm.
now just the focus of like the, not just pain control from the standpoint of being able to tolerate pain to do a dental procedure. I just mean all the thought that goes into every piece of it. It's just advanced over time. Am I off on that?
No, it has advanced, which is it's just nice. A lot of things are easier, even with you mentioned technology with
Mhm.
it in with a scanner, intraoral scanner. So now instead of you could just take a scanner, scan the whole tooth. It goes through a computer, of course. You send it to the lab.
Yeah.
They'll mill the crown and send it back. Now there are some dentists that have CEREC machines in their
Mhm.
dental offices, and they can just scan it and mill the crown right then and there, and then cement the crown within an hour or 2 hours for a visit. So there's just a lot of different things that can be done now. So
Man, that's amazing. It's
I
amazing. And
love it.
it's interesting to see what's gonna come next. You're gonna be in the chair and you're gonna be like, oh, you need a crown, you need this. I just give me yeah, let's see. How long you been here? Yep, we're gonna print that by 3D. Give me 20 minutes, 30 minutes, it'll be ready. Come back.
That's
Like,
right.
I see it one day. We're not there yet, whatever, but I see it. Like it's
There
gonna
are some
happen.
places that they are there. Yes, they are there. Yeah, so I love general dentistry because you can choose the
Mhm.
procedures you like to do. I don't place braces. I don't do orthodontics, but that's an area that
Mhm.
some dentists choose to take that direction. So it's just a lot of different fields between surgery and
Mhm.
then cosmetic work as far as veneers and bonding,
Mhm.
and then you have the the restorative portion as far as decay removal and and replacement for fillings. It's just a huge area. Tooth whitening,
Mhm.
and we just talked about implants a little bit, either a single tooth, a bridge, or dentures, the partial denture. You can have an implant with a partial denture also. Maybe you don't have the funds for, a full mouth
Mhm.
reconstruction, but maybe a couple implants and then attach that to your denture, your partial, to help hold it in. So a lot of different things.
All right, so this is kind of random, but I have to ask the question, because when I was preparing for this interview, I was like,
Mhm,
"Oh, is she gonna laugh at me for this question?" But I don't. I
mhm.
gotta ask. I'm
Okay.
not the only person that when they hit the toothpaste aisle, they stand there and they look, and they're looking at colors, and they're looking at all these different
Yes.
things, not knowing, like, it's like that's all marketing. So
Right.
like I'm just like, tell me about toothpaste and what we should be considering about toothpaste, and don't laugh at me too much because
Not
I
at
want to know.
all. No, not at all. The ADA seal, American Dental Association. If the toothpaste has the seal, that is good. That's one of the ones you can take. Because there's just so many different brands. I have my favorite, then my staff has a favorite, and both are really good. The two most popular brands. I won't tell you which is which. We like all of them. So, but as long as it has the ADA seal, because it's really not just the toothpaste, though toothpaste do have agents to help stop
Mm,
with bleeding.
mm,
But it's the actual brushing. You can have all the toothpaste you want, but if you're not brushing properly, you can still miss areas and still have plaque on your teeth.
mm.
So really, it's actually the mechanical removal of the plaque on your teeth.
Awesome. Well, I'm glad you didn't laugh at that question too much,
Not
because
at
when I was
all.
asked it, I'm like, come on. So I'm glad to hear your staff has a favorite. You have a favorite. All right, we're
Yes,
picking favorites here. We're good.
because you have flavors. I do like whitening toothpaste, but
Mhm.
sometimes with patients, their gums are too sensitive for that, so they have
Mm.
sensitive toothpaste. Some people have a dried mouth, and so their gingiva is a little more sensitive, so they can't use whitening toothpaste. But there's a lot of ADA, American Dental Association approved toothpaste that patients can choose from. Some like
Fantastic.
mint, some like spearmint, some like peppermint, right? I mean, what?
I got it.
I'm a
I got it.
spearmint person. Spearmint.
I'm in. I'm in. So Dr. Blunt, I have to
Yes.
tell you, this has been awesome having you on the show today. So it's not every
Thank
day I get
you.
to interview, bring the dentist on today, get some tips, get some like hygiene, dental hygiene tips, and bring that to my audience. And I love your angle and your concept, which is completely accurate, which is that the mouth, the teeth, the mouth, it's part of the body overall, how it's included. Like we need to rethink about that, especially if you haven't been to the dentist in a while, you haven't been thinking about that in a while. Like that's part of your body. Like that's an important part of your overall function, especially as you said, that neglect and things like that'll catch up to you later on in life. And when it does, it's going to be more painful. It's going to definitely cost more if you have more work that has to be done. So that preventive side of things is just so important. So that being said, so Dr. Blunt, if somebody is watching this and they want to learn more about Dental Design PC or to connect with your team, what's the best way for them to do that?
Well, I want to start with one thing. There are
Hmm.
people that have not been able to go to the dentist, and maybe
Hmm.
their mouth is in a state that they're not
Yeah.
happy with. That's okay. Start off, as I mentioned before, start
Yeah.
with where you are, because I have a goal. I see the ideal mouth, and my job is to help get you to that goal, be it
Hmm.
replacement, fillings, crowns, bridges, denture, wherever it is.
Yeah.
And so don't ever feel bad about going to the dentist if you feel your mouth isn't where it needs to be. But that's why we are here. So you can reach us at www.dentaldesignpc.com
Mhm.
or give us a call. And our number, I believe, is listed below there is 616-452-0400.
Fantastic. And we'll definitely put that in the show notes so that other
Okay.
people can, so they can go just click on it, be really simple and easy. We definitely want people to connect and to follow up. And so again, Dr. Blunt, thank you for coming on the show today. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. Hope you learned a lot. I know I sure did. If you did, don't forget, hit that subscribe button too. We definitely want you to be a return listener and a return visitor. Have many more mission-based entrepreneurs and businesses coming up for you, and we don't want you to miss anything. And Dr. Blunt, thanks again. It really has been a pleasure.
Well, thank you. It was nice talking with you.